We are, by all accounts, now in the sixth wave of the pandemic, this one driven by the BA2 variant. Some medical experts, though, are not surprised. Dr. Kashif Pirzada is an emergency physician in Toronto, and he just finished work, and he joins me now. Welcome to the program, Dr. Pirzada.
Thank you, Arthi.
Okay, so did you see wave number 6 on the horizon?
Oh, yeah, it was predictable, especially with the dropping of the mask mandates. This was inevitable, and I think any medical person could have told the government and the public that this would have happened.
So in terms of this sixth wave, what are you seeing? You just wrapped up a day at work right now.
It's very early, but the big pattern seems to be young families. Children are bringing it home to parents who are getting sick. There are a lot of absences in healthcare workers. So a lot of ERs in the city are having trouble keeping shifts staffed because people are just dropping from illness. So it's in the younger demographic, but it's going to spread to elderly people. And we're starting to see them come in too. In right now, small numbers, but it's picking up. And after a month and a half of not seeing it.
Now, is there a correlation then between when you say that you're seeing more younger people, more children who are perhaps bringing it home to their parents then? Is there a correlation between not wearing masks in schools and then getting the infection and bringing it home?
I think so. I think, removing the mask mandates, it's sort of acted as sort of gasoline on a fire. You had a lot of students return from March break, and in the last week, they've spread it to their parents who are spreading it to coworkers. Removing of the mask mandate came at the wrong time, and it's leading to this situation now.
And you said a lot of healthcare workers too. So the question is, will the healthcare system be able to handle this sixth wave? And it appears we're at the start of the sixth wave.
Oh yeah, like you're already seeing in the Ontario numbers, like I think 150 people hospitalized just in the last week over the week before that. So nobody knows what the end result, what the strain will be on the system. We only have half the population covered with boosters, and boosters make a huge difference in how severely ill you get. So we'll see, but we could have stopped this in its track by following the science and keeping some public health measures in place.
In terms of health measures in place and remaining in place, which ones do you think in particular should have been in place? I know you said masking might have helped.
So masking is definitely important, especially in crowded areas with poor ventilation. That acts as source control. It keeps you from emitting virus and infecting others. Another big deal that we've sort of ignored is ventilation. Like just today, Peterborough libraries are going to start displaying CO2 levels. That tells you how fresh the air is. That's something that needs to happen in all public places so that people know that they're walking into an area that doesn't have good ventilation. So that'll be a big help.
It sounds like you're saying, yeah, we knew this was going to happen and things shouldn't have changed. So why did they change?
I think, there's a lot of wishful thinking on the part of politicians that this is done. This is kind of like a movie with a beginning, middle, and end. This is more like a mini series that just won't end. Like we have to. This is a fight that we're going to have in a long term. Like this is a cycle that keeps happening. New variants will come our way. When we adopt a strategy that controls things at their source, that fixes things like ventilation, that's when we'll see success against it. Unfortunately, our governments have been very slow to do that, and we're going to be stuck in this loop forever.
Well, that doesn't sound very optimistic, but I'm wondering how bad you think this surge will get, given what you're seeing right now. We certainly saw the reintroduction of lockdowns with Omicron when that happened towards the end of 2021. What are you seeing with this sixth wave?
I'm worried about young children and elderly. So young children less than 5 who haven't been eligible for vaccination. They're still not eligible, even though Moderna might be approved by May or so. And elderly people above 60 or 70 where their booster dose from the fall is starting to wane by now. So, we don't know how bad it's going to get. It's hard to predict, but we need to be ready to impose measures again if hospitalizations start getting out of control. And then, like I mentioned before, we need to prepare for this kind of thing to happen on a regular basis by fixing things like ventilation in indoor spaces and encouraging masking when ventilation is not good.
Now, I know, Dr. Pirzada, you can't look into the future, but what do you think politicians should do? Should they reintroduce some of the measures that were lifted off?
I think so. Like they're probably trying to search for what things to do. There's an election coming up in Ontario, I know, but there needs to be a clever walk back. Like I think one compromise could be is that bring back mandates in areas where people have no choice but to go. where high-risk people like elderly and children have to go, such as schools and grocery stores, places of worship. You know, it's a big religious holiday season coming up with Easter, Ramadan, Passover. These are potential super spreading events that we can hopefully prevent by bringing in, mask mandates in those settings.
All right. Well, we very much appreciate your time and your insights. Thank you for this.
Thank you. Stay safe, especially the next couple of weeks.
Yes, will do. Thank you. That was Dr. Kashif Pirzada. He's an emergency physician in Toronto.